speaking today with Dr. Jennifer Phillips, who's a researcher at the Institute for Mental Health Research at the Royal Ottawa. Welcome, Dr. Phillips. Good to have you here today.
Thanks for having me, Mitchell.
I'm wondering if you could tell us a little bit about your areas of interest in research here at the Royal.
Sure. I'm primarily doing research in the fields of depression and in suicide prevention. We know that individuals with depression have very elevated risk of suicide, but we don't know very much about its biological underpinnings, and there are few treatments that are available. What we do know is that when somebody dies of suicide, there's generally a progression. They've gone from having suicidal thoughts or suicidal ideation towards making a plan and then eventually having an attempt. And my research, we're using a number of different approaches to try to better understand how somebody progresses along this pathway towards suicide. So one of the projects I'm involved in and leading is leveraging brain imaging technology to try to identify a biological signature of suicide in the brain. We are scanning patients that have depression who are also experiencing suicidal ideation, and we're comparing them to similar patients with suicidal ideation and depression, but those who have had a lifetime history of a suicide attempt. So people who have progressed beyond just thinking about suicide. And we're expecting to find differences in brain regions and networks in areas that are underlying things like decision making and impulse control and emotional regulation. And importantly, if we can identify these networks, these regions, we might be better able to understand a biological vulnerability for suicide. We can identify people who might be at risk, and we even might be able to develop treatments that are targeted to those particular brain regions.
Very interesting. Tell me, has the COVID crisis and the pandemic changed the state of mental illness and the opportunities for research in that area?
Absolutely. So a lot of our research with individuals, like human research, is actually on hold at the moment. It should be hopefully getting up and running pretty soon. But what the COVID pandemic has done is given us the opportunity to switch gears a little bit. So the research I had been doing was kind of at one end of the spectrum, looking at individuals who had already experienced prolonged depression or suicidal ideation. And now switching to also be looking at individuals who are at risk of developing depression or other mental health disorders because of COVID-19. So as you are probably aware, during the pandemic, most of us have had at least some increase in our stress. And chronic stress can be, if it's untreated and prolonged, can actually lead to mental health symptoms, even mental health disorders. And at particular risk of developing anxiety, depression, trauma are healthcare workers who are on the front line trying to treat individuals with COVID-19 and testing individuals for COVID-19. And under normal circumstances, this medical and nursing staff have, especially physicians, have higher rates of depression and suicide compared to the general population. So COVID-19 pandemic's really exacerbating existing challenges. What we're hoping to do in our research is better understand how some healthcare workers are resilient to this chronic stress that they're experiencing, while others are more susceptible to developing a mental illness. And it's really important that we take a look at this sort of now. We know that from the SARS outbreak in Toronto, even 3 years after the end of the outbreak, individual healthcare workers who had worked with patients who had SARS had continued to experience mental health symptoms, and some even still met criteria for mental illness. So we think it's really important to try to get an early look at that. We're also interested in not just looking at symptoms, but also looking at whether there is a biological consequences or physical toll of the pandemic on the mental health research, on the healthcare workers. So looking at things like chronic stress effects on brain structure. In my research, we've seen reductions in brain volume in certain areas. We see increases in stress hormones, increases in inflammation, and having an effect on the immune system obviously could be quite serious when we're facing an infectious disease. So it's really, the plan is to take a whole body look, the brain and the body, as well as the sort of psychological impact of the pandemic on the healthcare workers.
That's very interesting. So do you believe that this research that's being done at the Royal has the potential to really change people's lives for those living with mental illness?
I do. I think I'm very committed to conducting research that can be directly translated into improved care for patients. I know that some of the work we're doing investigating novel treatments for depression and for suicidal ideation is being translated into improved care for patients. It is being read, widely published, and implemented into novel treatment strategies. So I do think it does have a potential to make an impact. The suicide study in particular, if we're able to identify brain regions or targets, if we are able to identify treatments, if we can treat suicidal ideation, we may prevent somebody from progressing beyond thoughts towards making an attempt.
Jennifer, what motivated you to get involved in this area of research in the first place? What was your interest that brought you to this?
It's a great question, actually. When I first started and went to university, I applied to neuroscience. I actually was not accepted. I was accepted into environmental biology, and I worked for several years as a wildlife biologist prior to getting into this field. I studied dolphins in Australia, migratory birds in southern Ontario, and salmon in the Pacific Northwest. Eventually, I came back to Ottawa and was looking for a job and was able to translate those skills in science and in research into a job at the Royal. And after several years, I decided to go back to school and pursued my PhD in neuroscience, and haven't really looked back since. So I now teach neuroscience at both universities in town, so that's a nice thing. But I think I've always been passionate about mental health and interested in neuroscience, and am still fundamentally, I think, a biologist. So I'm interested in that aspect as well, and understanding not just the symptoms, but what's actually going on behind them.
All right. Well, thank you so much for taking the time today, and best of luck restarting your lab work. And we look forward to great success with your research.
Thank you, Mitchell. Thanks for having me.